And you're welcome also to come up to the front. This should be a cozy group. We're here informally to answer any questions.
I find out about a clinical trial, the ointment or some of these tumors.
So the inflection clinical trial is actually open through Mass General, and it's for individuals over the age of 18. So you would reach out to Dr. Plotkin or Dr. Jordan. There are some as with any clinical trial, there are some criteria. This particular one, you have to have a certain number of neurofibromas on the face. And a lot of kids and young adults don't have as many on the face yet. And that's why it's really older individuals who end up being eligible for that. And I'll let Dr. Anderson speak about the laser.
So for the studies that we're doing, they're in concert with MGH Neurology. If you're connected with that group, they can help you access our trial. Mass General Hospital also, if you just make inquiry about ongoing clinical studies. You can also reach me. I failed to give you my contact information, but I run this thing called the Wellman Center. If you want to remember that, you can reach us. The studies that we're doing are for adults 18 up, and you need to have 4 areas on your body, not on your face, that have at least 6 little tumors on them. We've changed those studies because of the success so far. We're actually doing much larger body surfaces now, so we can do whole arm or half your belly, that kind of thing. Yeah.
And I will say that if you have questions or questions about other studies that might be available, you can also put that in the comment section and just ask for somebody to reach out to you, and we will do so.
Is there a centralized location for studies? Like a database for NF study clinical trials or?
Yeah, so the Children's Tumor Foundation has a list of all available and open clinical trials, including those run by the NF Clinical Trials Consortium, which would include NF1 and all the schwannomatoses. And then NF Northeast also keeps track of resources, and sometimes there are local trials that will be listed on the more regional sites that aren't necessarily listed on the CTF site.
So I'm going back to the plexiform. If you have a plexiform and you've never had an MRI of it, but it hasn't changed or anything, should you request an MRI of that plexiform just to get a baseline?
So that's a good question. So, not all plexiforms are alike. In fact, no 2 of them are alike. So some plexiform neurofibromas are really just very superficial to the skin. You can see it. Could be a quarter-sized area. I'm typically not so concerned about those. And in fact, because you can see it and feel it, if you're not finding that it's large or having a change, I would just leave it alone. And typically those smaller ones aren't ones where I would consider putting someone on an oral medication to try and shrink it, because it does not have real potential to cause long-term effects or deficits. A larger plexiform, I would almost always image, because you never really know. You can see what it looks like on the outside, but you really never can tell what it looks like on the inside. And sometimes that's just the tip of the iceberg. So I'll at least image it the first time to get a sense of how it relates to the structures underneath the skin, or even deeper. And if it's still very superficial and just the outer layers of the skin, I would probably be satisfied with that. As a field, I think for those individuals who seem to have a lot of skin tumors or a lot of plexiform neurofibromas, there's some discussion about doing whole body scans once children reach an age where they don't need sedation, so that you can get a one-time look at whatever tumors they might have, internal or visible. Because again, you're born with them. So if you don't see them, it's unlikely that they would show up later. You could have tumors that change later in life. But again, if you did a whole body survey and you didn't see anything, I think you could be pretty reassured.
And what is a stir? What does the stir involve? Does it involve any medication or is it just a different?
Yeah, those of
level?
you who may have had an MRI in the past, there are lots of different things that sound like a knocking that may last from 30 to 60 seconds. Each one of those is called a sequence. So that's a different way that you can visualize the tissues and the body without in a non-invasive way. So sometimes it makes water look bright, sometimes it makes water look dark. So stir is just one of those, it's one additional sequence on top of a regular MRI. The reason why it's typically you need to ask for it is because it's not in the standard set of 5 or 6 things that's always done with an MRI. It's something that you have to add on.
Okay, thank you. And then Dr. Anderson, a question about, have you heard of electrodesiccation for, I didn't know how effective that is.
Yes, it's a good question. Electrodesiccation is one form of this electrosurgery. The radio frequency that I talked about is in there. And we use it a lot in dermatology to destroy skin cancer and warts and other things. If you do that for the neurofibroma, it works, but it's painful and you end up with a little scar almost all the time. But it's a useful thing to do. And that's more standard for what we do. If I just take a moment, I'm after things that don't leave a hole in your skin, are less painful, and are a lot faster, because I think if you were to do electrodesiccation on 1,000 tumors, there's no way you would accomplish that in a reasonable period of time, like an office visit,
Thank you.
Good morning or afternoon. Hopefully I can phrase this correctly. Earlier, they spoke about the likelihood of a benign tumor becoming malignant as 10%. Is that per person, or does that relate to per part of the body or where tumors exist? So if there's one in the head, several in the eye, and then also in other parts of the body, are they 10% each? Or is it 10% per person?
So it's, yep, makes total sense. So it's 10% over the lifetime of the individual. So that's a really important question. And typically an MPNST or malignant peripheral nerve sheath tumor, most of the time develops from an existing plexiform neurofibroma. So sometimes that happens in a place that you can see, and that makes it a little easier because you can see the change. Sometimes it happens internally where you can't see as well. And that's why I just want to reinforce what I was mentioning earlier, that any patient who has new onset of pain or new symptoms that are, I say, consistent or persistent, you're allowed to have belly ache every once in a while. You're allowed to have other aches and pains every once in a while, but something that's consistent and persistent and different should come to the attention of your doctor, even if you're not planning to see them for months from that. You don't wait for the next visit.
And I have one other question. My young son. Over the past week has numbness in his foot. But there's nothing to show that should happen.
Sorry to hear that. I will say that, kids are allowed to get different things that happen for different reasons. And most of the time they don't know if they've tripped over something or fallen on something or something like that. So it's much, much, much more likely to be something incidental that's happened than it is to be something neurologic at its origin. Okay, so come back up to what I was just saying. I would, make sure it's not swollen, try some ibuprofen, rest it, ice it, do all those normal things. And if it's consistent and persistent and really bothering them, then they need to come for medical attention.
Moved his MRI up.
Yep. Yeah. And I know that for lots of parents with and without NF, those new symptoms can be very scary. And you've got your radar on all the time. And that's why I use that rule of consistent and persistent, because that way you're not riding that roller coaster of every new symptom, right? Because kids are going to have different things happen, and adults.
By the way, you guys are the best.
I actually have a two-part question. Is there any correlation between the cafe au lait spots that a person has on their body? Does that tell you or give you an indication of how bad it would be for the neurofibromas to be on the person's body? And also if their lifestyle, such as stress, inactivity, their food habits, if that also has a way of showing how much or how aggressive their neurofibromas may be on their bodies?
Yeah, so those are good questions, and a lot of people worry or wonder about that. And we don't see, there have been studies that have been done to look at like how many cafe au lait spots people have on their skin and whether it has any connection with other symptoms. And it doesn't seem that there's any connection. So it's not like if you have more cafe au lait spots than the person sitting beside you, that you don't have any worse predictions about your health, okay, or your child's health. And then in terms of, remind me your second question. Oh, the stress, right, the stress and your lifestyle. Yeah, so we don't really have a good, to try to figure out whether things like your lifestyle, your stress level, if we did it from a scientific way, we would have to really study like a really large number of people, ask them a lot of questions about, and be having good ways to measure their stress level instead of just, what they think their stress level is and those kind of things. So we don't really have the information to know about that, but we can sort of guess about that from just what you hear about in the news, like if you watch TV news programs or talk shows where they talk about the general health benefits of trying to reduce stress. Those kind of same practical things are true for people with NF or schwannomatosis or pretty much any kind of condition. It's always beneficial to try to follow healthy lifestyle habits and eating a balanced diet and those types of things, yoga, whatever it might be. But we don't have data about that either, like to show that we can really change the number of neurofibromas or how they grow. Some of that's going to be beyond the control of healthy lifestyle habits. So what you want to add?
I just wanted to add to that. So once a child comes to me and they have more than 6 cafe au lait spots, I don't count. So I don't think it has a relationship between the other features. I wanted to add one thing to the lifestyle question, and that is that young adults and adults with neurofibromatosis are at risk for cardiovascular disease and at an earlier age than the general population. So in that particular circumstance, it really does matter. And I think about things you have control over and things you don't have control over. So you can't control whether or not you have NF or you don't, or your family history and your background genetics, but you can control things like smoking, whether or not you keep a sedentary lifestyle, your cholesterol, things like that, which are all independent risk factors for cardiovascular disease. And so I would say in that circumstance, trying to reduce any of those risk factors is certainly important. If I figured out the trick for reducing stress, I would promise I would pass it on. So yeah, I would share gladly, but I don't think that I'm not making light of it either. I don't know that we know that there's a link between tumor growth and things like that.
But you might feel better if you're doing those things.
Yes, true.
So can't hurt.
There is any medication pills for the NF? or there is a side effects if there is a pills for that?
You're talking about medications for the tumors or, yeah, so there is a lot happening in terms, we didn't talk about that. I think that's in various conferences we've had before, we've talked about new things and new treatments on the horizon for NF1 and NF2. So there are groups actively looking at through clinical trials. There's the Koselugo, which was approved by the Food and Drug Association back in 2020, just the beginning of COVID. That's specifically for children ages 2 to 18 with growing plexiform neurofibromas, but there are other medications in that category that are being assessed. So that's in a family of medication called MEK inhibitors. And that's the same type of medication that Dr. Anderson was referring to in terms of the skin growths and the neurofibromas that's being evaluated. And then there are the next trials to come forward will likely be what's called a combination therapy. We know that when you think about a tumor and tumor growth, there are lots of little streets that lead to tumor growth. So the MEK inhibitors, for example, block one of those streets, but there are streets that also continue to be active. And so a combination therapy is trying to hit the two biggest streets that goes at the tumor at the same time so that it does not provide the tumor with an escape valve so that it can continue to grow. So the next trial will be using a MEK inhibitor plus another drug at the same time. And we're continuing to look for either other drugs or other combinations of drugs that can be used. And then there are additional drugs that are being tested in schwannomatosis. And I know that's being discussed in the room next door. And there is a webcast coming up next week for patients to learn about the Intuit trial, which is a trial that's being run here at Mass General to test new agents in the schwannomatoses. So I would say there's more that's happened, as Dr. Anderson said, in the last 5 years than there has been in the last 35 years. So I would say that things just continue to change all the time. And that's super exciting. The fact that you heard about gene therapy and other things today, if you'd asked me that 2 years ago, I would have been more skeptical. But now I think it is on the horizon. Yes, maybe not in the next couple of years, but it is actually something that we think is going to happen.
Question for Dr. Anderson. Although my daughter has grown out of it, do you know what the cost is of the itching with NF1?
That is a wonderful question. Why do they itch? There was a theory for a while that there's a cell called the mast cell, which makes us itch. It's the source of histamine. And you know, it's present around blood vessels throughout your body. So in these tumors, if you look and you count the number of mast cells, they're enriched. The neurofibromas have more than their fair share of mast cells, which are capable of making the skin itch. Some people thought that maybe the mast cells were initiating this, and there was some small studies that were done to try and block using antihistamines and so forth to see that. I'm not a neurologist and I don't pretend to be an expert about NF, but doing these clinical trials and talking, to now many people with NF1, I'm pretty convinced they can tell you which tumors are going to grow, and they tell you by which ones itch. So when we look at take histories in the clinical trials we're doing and sort of choose which tumors to treat and so forth, it's a common story. But I think there's other factors as well. But I'm curious about your daughter. Does it drive her crazy? How much itching is there? We have other diseases where if you have atopic dermatitis, which is very common, by the way, that's 1 out of 8 people, and NF, those people are in trouble, right? They're they're primed to itch, and nobody in the family is sleeping at night because the kid.
And the other name for that is eczema.
Yeah, eczema. Sorry, I put on my doctor hat. So, yeah, but it's interesting. Your daughter outgrew it, you say?
Yeah, she had it a lot when she was younger. She used a lot. basically they had her on creams, like type of cream you would use for like
Mhm.
bug bites and stuff like that. They really didn't give her anything stronger than that, and just Benadryl, stuff like that. But she, as she got older, she grew out of it.
Well, I'm glad.
She had the itching where she would like break the skin, her nails, that type of itching at night with the deep sleep. Yeah.
And she was scratching the tumors. That's what was itchy, was the bumps. Yeah.
She don't have that many of them, so I can't tell if she was really scratching tumors or she was itching all over.
Yeah. Well, I'm glad she's better. But typically the antihistamines don't work for the itch of neurofibromatosis. I mean, I got interested in this as a dermatologist. Your question is really deep.
I would say too that a lot of kids that I see, they itch even if there's no neurofibromas that are visible. And sometimes I give them Sarna cream, which is non-steroidal, just because it's better long-term. And if you have darker skin, it's not going to take the pigment away from your skin in those spots. So I'm not sure we know the mechanism behind it. I will say that some of the drugs that have been tested in clinical trials specifically for plexiform neurofibromas block c-KIT, which is part of the mast cell cascade or the mast cell road. So those are the types of medications that we're combining with the MEK inhibitors. And the reason is a plexiform neurofibroma, a regular neurofibroma, yes, it involves the tissues around it, but not to the same extent as a plexiform neurofibroma, which includes a lot of different cell types, including the mast cell. So the theory is that you need to treat the whole process, not just the nerve-based process. And that's where the blockade of c-KIT and other things comes to play. We have had patients report less itching when they've been on the trials too. So you have to think of that it's something intrinsic to the NF process.
I think we have time for one more question.
One more question.
I'll make it short. This patient I happen to know who does have NF had 2 surgeries to correct the issue. And now this person now suffers from complete numbness, entire spinal cord, arm, hand, just constantly every couple of days, every other week. Any recommendations?
So numbness and pain, or yeah.
Not much on the pain side. The person can tolerate the pain, but when it gets to numb, they can snap completely upright and just stop doing whatever they're doing.
Yeah.
And it kind of comes and goes sporadically. And the person's employer isn't too happy about it.
Asking for a friend, of course. I would say the nerves can behave differently if they're injured. So sometimes what happens is if a nerve is injured in the process of its recovery, it can have unpleasant sensations come with it. So that can even be itching, burning, pain, things like that, even numbness. So there are a number of medications that are not specific to neurofibromatosis that can be used in that circumstance to make that nerve-based pain less uncomfortable. That would be something to speak to your NF provider about. Some of them actually work quite well and can make it so that those sensations are not so unpleasant. So that's definitely something to reach out for. Usually when those obnoxious sensations come back, that's a good sign because that means that there's nerve regrowth. So as uncomfortable as it is, I would see that as a positive sign. Nerves tend to regrow over months to longer. So while it can be uncomfortable during that time, I would say that's a good sign that that nerve highway is opening back up again. And to control the symptoms, people have used vitamin E on the skin. They've used ice or ice packs. They've used massage. So there are a lot of things besides medication that can be used as well. But again, there are medications specific for nerve-based discomfort that could be used too. I think that's it, but please don't forget to do your review and to go on the tour now if you are purple or blue.